My name is Denise Cooper. I live in Charlotte, North Carolina. I am a solopreneur, so I own my own company and it's just me. I've been doing this for about 5 years now, being on my own. Prior to that, I was with major corporations and I was a senior HR person. My last place was, I was a senior VP of HR. So I kind of know healthcare from multiple perspectives, either as a person who was brokering it for other employees, and now I'm sitting on the other side trying to broker it for myself. Once I left corporate America and then came out, the process of having to find insurance was very difficult because, one, it's very expensive. Regardless of how you chop it up, it's always expensive. And whatever pre-existing issues that you have are not covered. And at the time, my girls, I have twin girls, both were still with me, and both of them had special needs in which they needed to have coverage. And so when I found out that those pre-existing conditions, including my own, they said none of that would be covered. So it was kind of like, well, why do I need insurance if you're not going to help pay for the things that we have to have regularly checked? My one daughter, Shanita, she has to have her hearing checked, and she'd been in a very bad car accident, so almost died, and so she has some issues that she has to go through. And then we went to the doctor, and I told the doctor, we don't have any money, and we're not insured, and they were very, oh, no problem, we'll give you a great rate, etc., etc., and her first bill came back at $1,200. The next month, I had to go in, and my bill, and my doctor said, with all the discounts, it was still almost $800 for a 10-minute visit. And I kid you not, it was 10 minutes that I was in her office, and it was $800. And I didn't understand how I had to pay $800. I mean, I'm a private person. I don't charge my clients $800 an hour. Maybe I should to cover my medical bills, but I don't charge $800 for 10 minutes of time. And so from that point on, it was just a big struggle. Contrary to all the people who are, or at least many people that I hear, who have insurance from their employers, who are paying, you know, upwards of 70 to 80 to 90% of the cost of it, you have access. I don't have somebody paying 70, 80, 90%. Insurance companies make their decision on the balance and prediction of claims. And they have to have healthy and they have to have non-healthy to balance that out. And I get that. I get that. It's a pooling effect. I'm not Xerox. I'm not big companies. I'm not even little bitty company. I make enough money to cover my bills most months. And so this is just unfair. I've heard people say that, you know, access to health care is not a right, or anything like that. I mean, I think everybody's heard those comments of it's not a right. You might be right. It may not be a right, but it ought to be fair and accessible. That's, I think, is the real answer here.